Today, we're going to talk about something pretty incredible, a silent, unseen river that's flowing inside you right this very moment. It's a network that is absolutely vital for your health, but honestly, most of us barely know it exists. So we're going to dive in and uncover its story.
We all know about our heart and our blood, right? That tireless pump pushing blood through our veins. But have you ever stopped to think about the other fluid network? The one that's always working in the background, kind of like a cleanup crew, keeping everything in perfect balance?
Well, that unsung hero is your lymphatic system, and it's not an exaggeration to call it that. Think of it as your body's super sophisticated sanitation department and its elite security force all rolled into one. And understanding how it works is so important, especially when it runs into trouble. So, how does this whole system work? Well, the best way to picture it is as a massive, intricate highway for fluid. It's constantly busy, day and night, managing the flow and traffic of fluids all throughout your body. Its number one job is to collect this protein-rich fluid that naturally seeps out from our blood vessels into our tissues. It then scoops up this fluid and guides it back into our circulation. It's like a one-way street, constantly draining and filtering to make sure nothing builds up where it shouldn't. Okay, so the whole system works on this really delicate balance. On one side, you have the lymphatic load, that's all the fluid that needs to be moved. And on the other, you have transport capacity. That's how much fluid the system can actually handle. As long as the capacity is bigger than the load, everything's great. And that, right there, is where we get to the heart of our topic, lymphedema. This is what happens when that balance gets totally thrown off. When the amount of fluid, the load, overwhelms the system's ability to carry it away, you get a traffic jam, a persistent, stubborn buildup of fluid in the tissues. So what causes these traffic jams in the first place? It turns out the system can get backed up for a couple of very different reasons. Let's dig into that. Lymphedema is basically split into two main types. On one hand, you have primary lymphedema. This is pretty uncommon, and it's when someone is born with a lymphatic system that just didn't develop properly. But what's far more common is secondary lymphedema. This is where a perfectly healthy system gets damaged by some kind of external event. So what are these external events? Well, you might be surprised to hear this, but some of the most common causes are actually related to cancer treatment. For so many cancer survivors, surgeries that have to remove lymph nodes, or radiation therapy that causes scarring, these things can permanently damage that lymphatic highway. This creates a lifelong risk of lymphedema. Okay, so now that we know what lymphedema is and what can cause it, how do you actually spot it? What are the warning signs you should be looking out for if you think there's a lymphatic backup? The type of swelling itself can tell you a lot. In the early stages, you might see what's called pitting edema, where if you press a finger into the skin, it leaves a little dent for a moment. But as it progresses, the tissue can start to feel hard and dense. That's known as brawny. And in the most severe cases, the skin can get so full of fluid that it actually weeps or leaks out. One really key indicator that clinicians look for is called the stemmer sign. It's actually a pretty simple test. Can you gently pinch a fold of skin at the base of the second toe or finger? If you can't, that's considered a positive sign, and it suggests that the condition has progressed and the tissue has started to harden. This whole progression is formally broken down into stages. It starts with stage 0, which is kind of the silent or latency stage. The system's been compromised, but there's no visible swelling yet. In stage 1, swelling shows up, but it's reversible, meaning if you elevate your arm or leg, it goes down. By stage 2, it's considered irreversible. Elevation doesn't help anymore, and this is often where that stemmer sign turns positive. And finally, stage 3 is the most advanced, with really significant swelling and major changes to the skin. Now, this might all sound a little daunting, but here's the really good news. While there's no cure for lymphedema, it can absolutely be managed. There's a gold standard approach to treatment that really helps people take control. It's all about decongesting that lymphatic highway. This approach is called Complete Decongestive Therapy, or CDT for short, and it's broken down into two main phases. Phase 1 is the intensive part, where a therapist works with you to really focus on getting that swelling down. Then you move into phase 2, which is all about maintenance and empowering you with the tools for lifelong self-care. A huge part of CDT is something called manual lymphatic drainage. Now, this isn't like a deep tissue massage at all. It's a very gentle, rhythmic technique. And the key principle is that the therapist always clears the central areas first. It's like you have to clear the main highway in your torso before the traffic from the side streets in your arms or legs has anywhere to go. Makes sense, right? Another massive piece of the puzzle is compression.
In that intensive phase, this means special multi-layer bandages. But for the long haul, people wear compression garments. These give constant, gentle pressure to support the lymphatic system. They come in different classes, which is really just a measure of their strength. A therapist will figure out the exact right class you need, from a lighter Class 1 for a mild case in an arm, all the way up to a much stronger Class 3 for a more advanced case in a leg.
Okay, this is so important. That protein-rich fluid that's just sitting in the tissues, it's basically a perfect buffet for bacteria. This makes meticulous skincare absolutely non-negotiable. Even a tiny little break in the skin, a paper cut, a bug bite, a torn cuticle, can quickly turn into a really serious skin infection called cellulitis. That's why keeping the skin clean, moisturized, and protected is just top priority. All right, so living with a chronic condition like lymphedema really boils down to being proactive every single day. It's all about understanding the risks and building smart habits to keep that unseen river flowing as smoothly as it possibly can. And this daily management is made up of a bunch of small habits that really add up to make a huge difference. We're talking about things like avoiding tight clothes or jewelry, propping up the limb when you're resting, and, this is a big one, if possible, avoiding things like blood draws or blood pressure checks on the affected arm. These little things can help prevent flare-ups in a big way. And finally, let's talk about one of the most powerful tools in the entire toolkit, exercise. You see, when your muscles contract, they act as a natural pump, helping to move that lymph fluid along. The secret is to do it the right way. Always wear your compression, start with some gentle, central clearing moves like deep breathing, and then slowly progress. The goal isn't to go super hard, but to use mindful, controlled movement.
You know, the story of lymphedema teaches us something pretty profound, doesn't it? The systems we can't see are every bit as vital as the ones we can. By understanding this unseen river within us, we can not only manage a complex condition, but we can also gain a much deeper appreciation for our own incredible bodies. And it leaves you with a thought, right? What other hidden systems are just waiting for us to explore?